Good evening, I'm Nigel Booth, and today we'll be demonstrating examination of the lumbosacral spine. And lower back pain is a frequent presenting complaint to both the general practitioner and sports medicine practitioner. And according to good practice guideline, it's important that you have a system of examination of the lumbosacral spine, because this assists in directing investigation and management of these patients. It's important to recognize also that patients with lower back pain may have pain that is referred from the sacral island joint or from the hip region, and so examination of the lumbosacral spine would not be complete without examining the hip and the SI joint. So with me today is Donovan, and we'll be demonstrating these examinations. So we'll start off by doing an examination of the spine looking from the side, and what we're doing is inspection of the spine, and we're looking for lordotic and the kyphotic curve. So looking to see if there's no exaggerated kyphosis of the spine, making sure that there's no exaggerated lumbar lordosis or cervical lordosis of the spine. I'm just going to turn this way for me. Next, we're just going to inspect the spine, and what we're looking for is any evidence of scoliosis or twisting of the spine, any wasting of the muscles, looking at the eyelid crest to make sure that it's horizontal and there is no asymmetry, looking to make sure that there is no scar suggesting previous surgery, and sometimes in patients with spina bifida you might find a localized hair patch. Okay, from here we're going to just get Donovan to do movements about the spine, and patient with pathology along the lumbar spine, movement about the spine can cause exacerbation of these symptoms or pins and needle sensation going along the nerve root distribution. Turn this way for me, please. So we're just going to do forward flexion, bend forward, just giving a little pressure. Any pain or tingling? Okay. Turn this way, backward for me. Bending back. Any pain or tingling? Okay. On the side. Come along the side. Sit down. Yeah. Any pain or tingling? On the other side. Pain or tingling? Okay. So from here we're going to do what's called compound movements, and compound movements are going to be rotation, ipsilateral flexion, and extension. It's like reaching behind the knee. So it's like reaching behind the knee, right? Any pain? No pain. And same thing on this side. No pain. And usually with movement about the spine and compound movement, if there's any nerve root irritation, you'll get pain along the dermatomal distribution, or pain along the spine may represent degenerative disease of the spine. I'll just get you to sit up for me, please. Turn around. So with Donovan seated, what we've done is stabilize the pelvis. So we're able to do rotation about the spine. Turn for me. Good. On the other side. And what we're looking for is a movement and range of movement of the spine. Usually with rotation, you get about 40 degrees of rotation, most of it occurring in the thoracic region, and about 5 degrees range of movement occurring in the lumbar spine. Lean forward. From here we're going to do compression on the spine. Any pain? So pain with compression of the spine may indicate that there is some infection around the spine, or that there may be fractures around the spine, or tumors or metastatic process to the spine. Okay, from here we're going to get Donovan to do a squat. Squat for me. And with squat, what we're looking for is pelvic control. If there is any weakness of the muscle around the hip, that could cause you to have instability. And then one leg stand. With Donovan stand on one leg, sorry, turn around. Turn right around. One leg stand. With Donovan stand on one leg, we're looking at the pelvis to make sure that there is no Trendelenburg sign, where you get a fall of the pelvis to the side that the leg is off the ground, suggesting hip weakness, and that's normal. And we're also looking at balance. Walk for me, please. As Donovan walk, we're just looking to make sure that he has no restriction of movement, no suggestion of pain. Heel and tiptoe walk. And as he walks on the heel and the tiptoe, this is a test of L4 to S1 muscles supplied by the L4 to S1 nerve root. If there's any irritation of these nerve roots, you may get weakness of these muscles, suggesting a pathology there in the spine, and that was normal. Okay, can I get you to lie down for me, please, and lie flat? So with Donovan line, we're going to do palpation of the spine. We just palpate it along the spinal process, checking for pain or instability. Any pain?
No pain.
No pain?
No. No.
Next we want to palpate along the SI joint. Any pain?
No pain.
Good. Transverse process. Any pain?
No pain.
And that's on both sides. Then we want to do the paraspinal muscles. Paraspinal muscles. Any pain?
No pain.
And that's on both sides. And we want to do the quadratus lumbatum, which is a muscle that runs from the 12th rib to the iliac crest. And what we're feeling for is any evidence of pain or any scarring in the muscle, which may be felt as knots in the muscle. And we're doing that on both sides also. No pain. Good. From here we want to do palpation of the gluteus, then gluteus maximus, gluteus minimus and medius, greater trochanter. Any pain?
No
And we want to do ischial tuberosity. Any pain?
pain.
Okay. So, having completed the examination, the palpation of the spine, hip, and sacroiliac region, we'll move on to do nerve testing. And if there's any evidence of nerve root irritation, stretching the nerve may cause you to get pain along that nerve distribution. Additionally, if there's nerve root irritation, you might find weakness or loss of sensory function of the nerve based on that nerve root distribution. So these are the things that we'll be testing. So first we're going to do a femoral stretch test, and the femoral nerve is supplied by L2 to L4. Just bending in. Any pain?
No pain.
Huh? Any pain?
No pain.
Okay, if there is any femoral root involvement, then you'll get pain along the anterior thigh. Turn around for me, please. Lie back, lie back, lie back. So from here we're going to do a straight leg raise. So leg up. Knee straight. Any pain?
No pain.
And with a straight leg raise, if there's pain, dorsiflexion of the foot may exacerbate that pain, or bringing the head up exacerbate the pain. Good. Or flexion of the knee or plantar flexion will relieve that pain. Sit up for me. And straight leg raise is testing for an irritation of the sciatic nerve. So from here we're going to do what's called a slump test. So just leg up, dorsiflexion, head down, compression, any pain or tingling. And a slump test also tests for any evidence of nerve root irritation along the sciatic, and that would also cause pain or numbness or tingling along the leg. So from here, we're going to move on to do motor, sensory testing and reflex. So just get the pamphlet for me. So we're going to be testing the nerve root, sensory function first. So along the medial upper thighs, L2, and what we're checking for is sensation. Do you feel me touching you?
Yes.
Is it the same on both sides?
Yes.
On the lower medial thighs, L3, same on both sides. And L4 is going to be on the medial side of the leg.
Same.
And L5 is going to be the lateral aspect of the leg onto the medial side of the foot.
Same.
S1 is going to be the sole.
Same.
And L2 is going to be the posterior thigh. Yeah.
Same.
Feel it?
Yeah.
And S3, 4, and 5 is going to be on the buttocks going into the perianal region. Okay, and that could also be tested. So from here we're going to move on to do reflexes. Okay. Good. And that's a patellar reflex, and patellar reflex is going to be testing L3 and L4 nerve root. Ankle reflex, and the ankle reflex is going to be testing the S1 and S2 nerve root. Good. From here we're going to do muscle strength. Push your knee up like that for me, keep it up. And that's L2, straighten the knee for me. L3, put the foot up. L4, put the big toe up. L5, push the foot down. S1, bend the knee. S2. So that completes for us the nerve examination of the lumbar spine. As I've pointed out before, it's important also to examine the hip and the SI joint, so we will demonstrate that now. Right from here, please. So first we're going to do movement about the hip. So first, rotation, any pain?
No pain.
Okay. Flexion, any pain?
No pain.
Internal rotation, external rotation,
No pain.
ADD, adduction, abduction.
No
No,
pain.
and there is no evidence of, so there's good range of movement of the hip. So from here we're going to do what's called a fair test. So fair is flexion, internal rotation and adduction, ADD adduction. So any pain? And with the fair test, if there's pain along the hip, suggestive of a hip pathology. In the fair position, we can also do what is called a thigh thrust test. Testing for the SI joint, any pain?
No pain.
Okay, if there is any pain in the SI joint region, that's indicating SI pathology. So from here, we'll move on to the Faber test. And the Faber is going to be flexion, abduction, AB, and external rotation. And it's like crossing the leg like the number 4. And in this position we are doing pressure. Any pain?
No pain.
If there's pain anteriorly or pain around the hip, it suggests a hip pathology. Or pain at the SI joint suggests a SI joint pathology. Right now. So from here we're going to do a distraction test on the pelvis. Any pain in the back?
No pain.
And the distraction test also testing the SI joint region. Roll on to the side for me. And we're going to do a compression test. Pelvis, any pain?
No pain.
And a compression test also tests the SI joint integrity. Stand up for me, please. So with Donovan standing, we're just going to do what's called a stalk test. And the stalk test also tests the SI joint. So stand on one leg for me and lean back. Okay, any pain in the back?
No pain.
Okay. So, as you see, I've demonstrated 5 tests related to the SI joint. The thigh compression, the Faber, the distraction of the pelvis, compression of the pelvis, and the stalk test. And it's recommended that if 3 or more of these tests is positive, it's highly suggestive of a SI pathology. Less than 3, it's less likely to be an SI pathology. So with this, we have completed the examination of the lumbar spine, including the hip and the SI joint. Thanks for having us. Have a good day.